It is now my pleasure to announce our guest speaker, Dr. Michael McCawley. Dr. McCawley graduated with a bachelor's degree in zoology from George Washington University. He received a master's degree in environmental engineering from WVU and a doctorate in environmental health from New York University. He spent over 27 years as a public health service officer with the CDC at the National Institute of Occupational Health, Safety and Health, studying miners' health, occupational respiratory disease, aerosol measurements, and ultrafine particles. While there, he worked on projects concerning exposure to wood dust, volcanic ash, diesels, coal mine dust, silica, and beryllium. He retired from the U.S. Public Health Service in 2001. He's taught at WVU since 1979 with primary interests in air pollution, aerosols, and occupational health. He's developed air sampling equipment and pulmonary function tests, and recently has been working on issues related to mountaintop removal and Marcellus shale drilling. Dr. McCawley.
Thank you. It's nice to see everybody here today. I usually like to start off with a story about who I am and who I'm not. So part of what I do is epidemiology, and I know there's another epidemiologist here in the crowd today, or two. And so people say, what does an epidemiologist do, or what are they? What's an epidemiologist anyway? So I like this story that sort of typifies it. It's these two guys go up in a balloon, and they go up in a cloud, and they're lost in the cloud for a little while. When they get out of the cloud, they can't tell exactly where they are, but they're low enough to the ground that they can see somebody down there. So one of the fellows looks down, yells down out of the balloon, "Hello down there." The person down on the ground looks up, waves to him. The person up in the balloon says, "Can you tell us where we are?" The person down on the ground says, "Yes, you're up in the air." And the other guy in the balloon says to the first one, he says, "What did he say? Who was that?" He said, "Oh, it was just an epidemiologist." He said, "How do you know that?" He says, "Well, because what he told me was completely true, but absolutely useless." So hopefully, what I'm going to say today is not going to be absolutely useless. I don't know how can you?
If you want, I can advance it.
Yeah, okay, that'd be great. So I'm going to be talking about ultrafine particles. And I did a lot of this kind of research when I was at NIOSH. I've continued this kind of work since I've been retired from there and working at the university. It's a particular interest to me. It was a particular interest when I was at NIOSH because I was doing work on diesels and diesel exposure in underground coal mines. And so I spent a number of years working in the coal mines. I, in fact, helped write a lot of the new dust regulations for the coal mines while I was at NIOSH, and so I was happy to see those finally being promulgated. So if you're expecting me to sort of come here and bash coal mining, I'm not going to do that. You'll have to make up your own minds with this. But what I am going to do is I'm going to give you the science. And I'm going to tell you some things about science that you may not know, but that you should know. So, next slide. When we started looking at mountaintop removal mining processes, I was at West Virginia University with Dr. Michael Hendricks, and we became good friends. And he was telling me about the symptoms they were seeing there. And the symptoms they were seeing was an association in the areas where the mountaintop removal was with pediatric asthma, with cardiopulmonary disease, and with cancer. And he said to me that they were going to be looking at PM10, PM2.5 dust levels. I said, well, that's interesting, but given my background and experience, have you thought about ultrafine particles? I said, well, no, why? I said, well, the literature says these are the 3 diseases that you'd most often see if you were overexposed to ultrafine particles. Next slide. So what is an ultrafine particle? An ultrafine particle, also sometimes called a nanoparticle, is a particle that's less than 1/10 of a micrometer in diameter. how big is a micrometer? Well, human hair is 100 micrometers in diameter. So you know how fine a human hair is. Well, a micrometer-sized particle, you could take 100 of those and stack them up across the thickness of a human hair. That's really tiny. Except ultrafine particles are 10 times smaller than that to 100 times smaller than that. So they're 1/10 of a micrometer to 100th of a micrometer. So you could take 1,000 to 10,000 of these tiny particles and stack them up over a human hair, the thickness of a human hair. So it's really, really tiny. In fact, they're so tiny, they're getting down close to the size of molecules. So they're really only a few molecules big, which is very, very small. And because of that, they have some properties that are of concern to those of us who do the toxicology and the epidemiology work. Next slide. But to do that work, we have to look and see how many of these particles there are, what size distribution we have, whether they're bigger ultrafines or smaller ultrafines. And as I said, they're also called sometimes nanoparticles. So if you hear people talking about nanoparticles and ultrafine particles, they're both referring to the same size thing. It's particles less than 1/10 of a micrometer in size. The only difference is the nanoparticles are generally manufactured to be specifically that size, whereas ultrafine particles just happen to occur to be that size. So it's this somewhat indistinct distinction between the two, but they both refer to these really tiny particles. And the equipment that you see there in the back of my minivan runs about $150,000 worth of equipment in 3 or 4 small boxes. And so scientific equipment is very expensive, and the reason why you may not have heard much about people doing work on ultrafines is to get into the field takes a pretty high budget to start with. And so it's sometimes hard to come up with grants that will cover that kind of thing. We were fortunate enough, actually, to get grants to buy this kind of equipment and be able to use it. And of course, this is out in Boone County where we were doing a lot of our sampling work, including around Maria's, where we first met. Okay, so next. And when we got the results back, this is kind of what some of the results look like from this, which doesn't maybe make much sense to anybody. What this is a particle size distribution. And it says on the bottom line, those are diameter in nanometers. Well, scientists don't always like to use lots of decimal places. They like big numbers. And so instead of saying this is 1/10 of a micrometer or 100th of a micrometer in size, they say this is 100 nanometers or 10 nanometers in size. 100 nanometers is 1/10 of a micrometer. So what you're seeing here is something that is 1/10 of a micrometer in mean size, because these are actually 2 bell curves that have just kind of overlapped one another. You remember the bell curve, that's where you fall in the distribution of things. I like to remind people that I fall on the bottom of the bell curve in all sorts of categories. You can ask my wife. But in this case, the mean of this distribution, the average particle size in this distribution, occurs at that very first largest peak. So that's about 100 nanometers, about 1/10 of a micrometer in size. So what we were looking at were truly nanometer size, ultrafine particles. In this particular case, there were 2 distributions, which mean there may have been multiple sources, that kind of thing. And in fact, what we're also doing is this is not a mass distribution. So this is not how much the stuff weighs. This is the number of particles. And the distinction there is very important, because if you do sampling for the EPA for regulatory purposes, you find the mass of particles that are out there. Well, the scientific literature seems to indicate that the mass of these ultrafine particles has nothing to do with toxicity. It is the number of particles. So if you're measuring mass, it's telling you nothing about the ultrafine particles. To start with, it gets better. Next slide. So in this red box, which I apologize for being a little small, there are particulate matter. These are the national ambient air quality standards. These are the allowable limits for different kinds of contaminants in the air. And for particulate matter, there are two distinct classifications, PM10 and PM2.5. Now, I worked in the government. We had acronyms for everything. We like to work in acronyms. I don't know, I guess we don't like to say extra words, although if you've ever been in the government meetings, people never seem to run out of extra words for hours on end. But PM stands for particulate matter, and PM 2.5 is particulate matter less than 2.5 micrometers. So 2.5 micrometers would be about a 50% size. 50% of the particulate that you'd collect would be a little bit larger than 2.5 micrometers, and 50% that you collect would be smaller than 2.5 micrometers. The same thing applies to PM10. PM10 is for 10 micrometers, bigger particle sizes. Now, these criteria actually come about, strangely enough, because of coal mining. When people were first interested in what causes black lung, they wanted to come up with a size of dust that caused black lung, because if they measured all of the dust in the coal mines and tried to correlate that with the risk of black lung, they didn't get any relationship between the two. They know that coal dust causes black lung. But if you can't get a correlation between what you're measuring and what the disease is that it causes, you must be doing something wrong. And I said, well, what we're doing wrong is maybe we're looking at the wrong size particle. So they had the lungs of deceased miners, and they started looking inside them, and they washed them out, and they get the material that came out, and they put it under a microscope. Lo and behold, most of the particles that they got out of the coal miners' lungs were 5 micrometers in size. So they said, that's interesting, because if we look at the dust in the mines, it's all different sizes. It's not just 5 micrometers. And so they said maybe the lungs have a specific way of selecting just some sizes and depositing them in the lungs, and not other sizes. Other sizes, they may breathe in and breathe back out again. Next slide. And this is what the lungs look like. The lungs are like a tree built upside down. The trachea in your throat here is like the trunk of the tree. And the bronchi, that's actually Latin for branch. They're like the branches of the tree. And the alveoli on the end, which is the part that you really do your breathing with, those are just like the leaves on a tree. So CO2 and oxygen pass in and out from these things, just like they do in leaves. So the branches are where a lot of these particles deposit and where you get a lot of the lung disease. And so the mechanisms for doing that, there are 3 different ones. These are all fluid mechanic type things. This slide is in fact from a doctoral class, so you guys all now have honorary doctorates, if you're not asleep yet. So, because there are these 3 different mechanisms, it gives a funny shape to what gets captured in the lung. It's not just all 5 micrometer particles. Some particles come along and go whizzing through the branches, and they impact at the bends, at the branching points. Other particles will settle out slowly as they're moving along down into the lung, and then others will move by Brownian motion. Now, if you remember, maybe back in high school chemistry, they talked about Brownian motion for little tiny things. It's this random movement that these little tiny things have. And the tinier they are, the faster they move. And so this Brownian motion, which we call diffusion, will cause things to vibrate through in the air, and they come in contact with the walls of the lung and deposit. So 3 different mechanisms. Next slide. And so what that does in red here is there are 3 mechanisms. Every time there's an upswing or a downswing, it's a different mechanism. The very first upswing in that red from the right-hand side, and this, again, these are in micrometer sizes. So that very first upswing is the stuff that's crashing into the walls. The next downswing is the stuff that's settling out, and the next upswing is the Brownian motion. So there are 3 different mechanisms going on, and they change what deposits in the lung by size. So if you're a 10 micrometer particle, you have a different chance of actually being captured in the lung than if you're a 1 micrometer particle. And we call that size selective deposition. And deposition is important because deposition determines dose. Something has to deposit in your lung before it's a dose to your body. So if I put a cyanide pill on the table and just left it there, it wouldn't poison me. If I put it in my mouth and swallow it, then it's going to poison me, right? I have to get it into my body. Same thing is true of the particles. You have to get them in and keep them in your body before they can do this toxic work. And that's a very important, basic toxicological principle. Now, here's the important part. The black line here is the way the EPA samples the dust out of the air. Technically, the black line and the red line should have exactly the same shade for the EPA to be able to tell you what the dose of dust is you get out of the air. And as everyone can see, the two are almost indistinguishable. Well, maybe not. But that's what PM10 is. PM10 is size selective. Okay? But it's not size selective as long as size selective. Unfortunately, PM10 is an old holdover from the way we thought the lung worked in the 1950s. So it's science that's almost, well, in fact, over 50 years old. But it got written into the regulations, and it's never been changed. All right, so there's PM 2.5. Maybe we got a hope. Next. So again, the two lines are virtually indistinguishable. Well, lose again. All they did was they took the PM10 line and moved it left because they couldn't find a really good relationship between what people were exposed to when they measured PM10 and the disease. Not so astoundingly, I suppose. And they have the same problem with PM 2.5. They had to hire a really famous epidemiologist at Harvard to sort of twist the data around and turn the data this way and that way and ignore this thing and not pay attention to this other thing to really say, yeah, this PM 2.5 should work. It doesn't. And when we look at the ultrafine particles, those are the particles less than a tenth of a micrometer, and you can see where 0.1 is on this graph, and 0.1 and that line goes up to 100%. They don't look alike. Not only do they not look alike, but all of the data that the toxicologists have been able to put together on these ultrafine particles say it's the number, not the mass of the particles. So the EPA is measuring mass. That's not related to the number. So if they were to make the argument, well, you know, we measured the mass and these ultrafines are just a small portion of that mass. Well, it's a small variable portion. It would have to be a constant portion, and it's not. It's not because the size of particles in the air change depending upon, say, how close you are to an explosion, or how far away you are, or whether it's coming from a truck or a piece of dynamite going off. Right. Next slide. So you have to know the size of the dust in the air to start with. And then you have to know what percentage of that is going to deposit in the lung. And once you know those two things, you multiply one percentage by the other, and you get the dose. They never did that in any of their epidemiology. They ignored the size of the dust. That's wrong. And so they couldn't come up with what is a dose for the lung. And they entirely ignored the ultrafine particles. Next slide. How far off are they? Well, they're pretty close by government standards. You've heard the expression, close enough for government work? Well, they're only off by maybe 300 or 400 or 500 or 600%. kind of in the same ballpark, as long as you've got a really big ballpark. And you can do that if you've measured the size distribution, as we actually did measure the size distribution in these areas. And so we found in this area they were off between 400 and 500% between what was actually depositing in the lawn and what they would have thought was depositing in the lawn. Not particularly good. And the black dot is what you'd see from diesels. Now, diesels are a particularly good source of ultrafine particles. They tend to be almost all ultrafine in their exhaust. So the next time you're behind a bus or a big truck, think, ooh, I'm getting my ultrafine particle exposure of the day. I don't have to go to the gym. So, next slide. So, just how nasty are ultrafine particles? Turns out they're really, really, really nasty. You see, your cells have something around them, a coating, to protect them, called a membrane, a cellular membrane. The cellular membrane is there to keep dirt and junk out of your cell, because if you get dirt and junk in your cell, the cell doesn't work so well. It's like getting dirt and junk in a very fine, very, very fine Swiss watch. So if that happens, things don't go right very well. And the membrane is really, really good at keeping out big particles, like bacteria. Except the membrane has pores in it. A pore is basically a hole. And guess how big these holes are? About 1/10 of a micrometer in size. Remember how big our particles were? Less than 1/10 of a micrometer in size. Guess what the membrane is no good at keeping out? Ultrafine particles. So they get in the clockwork of the cell, and they cause things to go wrong. And you remember how I said, oh yeah, here's this list of things, looks like it could be ultrafine particles causing this list of witch's brew of disease that you're seeing. So in the published literature, significant positive associations between heart disease and ultrafine particle exposure. 2015 published. Decrements in evening peak flow in asthmatics. If you're an asthmatic, you're very concerned about your peak flow because that tells you just how healthy you're maintaining your lifestyle with your asthma. Decrements in your peak flow means decrements in your health. And these occur with ultrafine particle exposure. Interestingly, titanium dioxide, next, that third dot down. Titanium dioxide is the white pigment in paint. It's as non-toxic a stuff as you'd ever want to be around. You can breathe that stuff in all day long, and it really does not do much to your lungs, as long as it's not ultrafine. So when these rats were given the same dose of titanium dioxide, TiO2, in a mass form, in larger particles of size, nothing happened to them. When they gave them the same mass in ultrafine particles, they killed them. Not a good outcome for the rat, at least. As little as 8,000 particles per cc, that's number concentration, okay, were sufficient to show a significant increase in children with asthma having to go to the emergency room to be treated. And mice exposed to carbon nanoparticles develop cancer at enormous rates. It's really carcinogenic. This is carbon. This is the stuff in your pencil lead. This is not hydrocarbons. This is carbon. And finally, the EPA likes to point out that they really don't have a lot of information on ultrafine particles. There have only been 365 published papers so far dealing with ultrafine particle toxicity. If you widen the search, you'll probably find you can get the numbers up to around 1,000. So your government is at work. I used to have a badge that I wore when I worked for CDC. It said, "I'm from the government, I'm here to help." Next. So when we did our study of mountaintop removal, here were the areas. In the gold circle, that was our control population area. The red circle was our major area for doing exposures, looking at exposures. And of course, we were monitoring the ultrafine particles. Next slide. And of course, in these areas, we see people dying a lot sooner and a lot faster. And that's what these slides say. The age-adjusted mortality per 100,000 by mountaintop mining counties. Much higher in the red there than for the other regions of Appalachia or regions outside of Appalachia in yellow. Next slide. Again, these are from papers by Michael Hendricks. Again, there is an excess risk of lung cancer deaths in mountaintop mining areas. Remember the mice and the carbon. Next slide. Non-cancer lung disease deaths, also higher from the mountaintop mining. Remember the inflammation and the bronchoalveolar stuff in that other, yep, same thing, same list. And these were the list of slides that I saw from Michael Hendricks before I said, oh, yeah, you know, we should look at ultrafine particles. There's a smoking gun here, I think. Now, I went in, still, all of this, a little bit skeptical. I bet on the Mountaineers for Thursday's game. 2. So, next slide. As it turns out, the biggest difference between the control area and the mountaintop mining area were the concentration of deposited ultrafine particles in the air. So it's a thing that does separate out the two areas. Now that's a correlation. I want to point this out because a lot of times epidemiologists play fast and loose with correlations. I don't want you to misunderstand this, okay? Causation and correlation are not the same thing. We're not saying causation here yet. But correlation is defined this way. If I see a rise in the number of ice cream cones eaten with the number of butterflies in the air, I can say I have a correlation between ice cream cones and butterflies. That does not mean that eating ice cream cones causes butterflies. Okay? It only means that the two are co-related. They're co-related to the temperature of the weather outside, right? As it gets warmer in the summertime, people eat more ice cream cones and you see more butterflies. Correlation there. What we have here is kind of a correlation between an increase in disease measured in one study and an increase in the concentration of these ultrafine particles. Now there are things that you can do to up this to causative, okay? Did we see them along the same sort of patterns, in the same kind of places? Is it biologically plausible? So we're showing, in fact, that this is biologically plausible. That's not the point of this talk, actually. Although I know a lot of you guys want to hear about mountaintop mining. I want to talk about something that is a broader topic than that, really. We have no regulations for ultrafine particles, okay? So the DEP can't enforce a regulation for ultrafine particle generation. The company is under absolutely no reason to control ultrafines. It's not regulated. These are not regulated things, all right? They're not being bad people. They're just, there's no reason to do it because there's no regulation. Should there be a regulation? Oh, absolutely. We realized that when I was on committees that recommended these kinds of size selective sampling 30 years ago. 30 years ago, there was a reason for doing this. I think that's a long enough time to wait to say, let's take a look at what the data is that's out there. Because in fact, the coal mines have to abide by PM10 and PM2.5 regulations. They have to take all sorts of measures to control those kinds of things. If those are worthless metrics, they're wasting their money. They're wasting our money. Because there's a network of these PM10 and PM2.5 monitors throughout the United States. And if that's what we're using to say we're controlling the things that will make us sick, we could be really far off base. And the only people that can change that are the legislators. Yeah? The federal legislators, which means getting Congress to do something. Now you can laugh. But they're not going to do anything if we don't let them know that they should be doing something. We are kind of all in this together. Both the coal companies and us are in the same boat on this one. It is our health, however. Their wealth, our health. And so it's time to say something about this. Next slide. So just to remind you, what we said, what I've said today was that ultrafine particles are in fact capable of producing health effects. There is a lot of literature that shows that. No question about it. Ultrafine particles are not directly and probably really for the most part not even indirectly regulated by the government. And the way the government regulates things right now may not be the best way they can do it, and that's probably a major understatement. We have not been able so far with this first study that you just saw been able to characterize severity versus concentration. All we've got is there is something happening and this is a concentration at which it's happening. The kinds of concentrations that we were seeing were 8 to 10,000 particles per cc around here in Boone County. And remember, 8,000 was enough to cause pediatric asthma, exacerbation, excess people, excess children showing up at the emergency rooms. And because we have not been monitoring these kinds of things, don't have a monitoring system, and don't have regulations, the sources and strengths of the sources have not been well regulated. So we can't say, you know, are you controlling these things if we don't know to what level you're supposed to control them? And the only people that can say that are the regulators or the legislators. And so something needs to be done. It needs to be done now. 30 years is, I think, long enough to wait. I can show you the documents that we put out stating that this is something that needs to have regulation done for it. Next, I think that was the last slide. Yeah. Any questions?